Good morning, Alfred. Let's begin your NHS interview. What do you think you will be doing on a day-to-day basis in this role?
As an NHS nurse, my day-to-day responsibilities would encompass a wide array of tasks aimed at providing comprehensive care to our patients. Starting with the handover from the previous nurse, I would receive detailed updates on each patient's condition, recent treatments, and any noteworthy developments. This initial briefing sets the stage for the day, allowing for seamless continuity of care. Drawing from my experience, I'm well prepared to handle the demands of this role. Having worked in various clinical settings, I've developed strong assessment skills, adeptness in medication administration, and proficiency in wound care. For instance, during my tenure at Mihiraa Multispeciality Hospital, I spearheaded a project to streamline medication administration procedures, resulting in a notable reduction in medication errors and an improvement in patient safety outcomes. Throughout the day, I would engage in a multitude of tasks ranging from conducting patient assessments to administering medications and providing treatments as prescribed. Vigilantly monitoring vital signs, accurately documenting observations, and maintaining effective communication with the healthcare team are integral parts of my routine. My experience in managing complex cases in fast-paced environments has honed my ability to prioritize tasks and make swift, well-informed decisions under pressure. Furthermore, I'm genuinely enthusiastic about learning and contributing to the collaborative environment here at the NHS. I understand the importance of staying abreast of the latest evidence-based practices and actively seek out opportunities for professional development. By actively engaging in ongoing learning and fostering a culture of excellence within the team, I'm committed to making meaningful contributions to the delivery of exceptional patient care.
Describe a time when you have been unable to follow through on a commitment that you made. What happened? How did you explain this to the other party?
During my time working in a busy surgical ward at Mihiraa Multispeciality Hospital, I found myself in a situation where I was unable to follow through on a commitment I made to a patient's family. The commitment was to ensure that I would be available to provide them with a detailed update on their loved one's condition following surgery. Unfortunately, on the day in question, we experienced an unexpected surge in emergency admissions, resulting in a significant increase in workload for the entire team. Despite my best efforts to prioritize tasks and manage my time efficiently, the demands of the situation meant that I was unable to step away from patient care to provide the promised update to the family at the agreed-upon time. Understandably, the family was disappointed and concerned about the delay in receiving information about their loved one's progress. However, as soon as the workload on the ward allowed, I made it a priority to approach the family, explain the situation, and apologize sincerely for the delay. I provided them with a comprehensive update on their relative's condition, ensuring that they were kept fully informed and reassured about the care being provided. While I regretted not being able to fulfill my commitment to the family as originally intended, I believe that my prompt and transparent communication with them helped to mitigate any frustration or anxiety they may have felt. This experience highlighted the importance of adaptability and effective communication in healthcare settings, particularly during times of unexpected challenges or increased workload. Moving forward, I remain committed to ensuring clear and open lines of communication with patients and their families, even in the face of unforeseen circumstances.
Tell me about a time when you needed to change your point of view to take into account new information.
In my previous role as a nurse in a rehabilitation unit, I encountered a situation where a patient's progress was not meeting the expected milestones despite following the established treatment plan. My task was to ensure the patient's rehabilitation plan was effective in promoting recovery and improving their functional abilities. Initially, I adhered closely to the established treatment plan, believing it was the most appropriate course of action. However, Upon reassessment of the patient's condition and consulting with the interdisciplinary team, it became evident that certain aspects of the plan needed adjustment to better suit the patient's specific needs and limitations. Despite my initial reservations, I recognized the importance of being open-minded and flexible in adapting the treatment plan to optimize the patient's outcomes. By incorporating new information and adjusting the rehabilitation plan accordingly, we observed a significant improvement in the patient's progress. They demonstrated increased mobility, independence, and overall well-being, which was a testament to the effectiveness of the modified approach. The patient's satisfaction with their progress further validated the decision to change my perspective and embrace a more tailored approach to their care. This experience reinforced the importance of remaining receptive to new information and perspectives in healthcare. It taught me that being willing to adapt and modify my approach based on evolving circumstances and insights is essential for providing patient-centered care and achieving optimal outcomes. Moving forward, I am committed to maintaining a mindset of continuous learning and flexibility, ensuring that I can effectively respond to the unique needs of each patient under my care.
You are working in a busy emergency department, and a patient arrives complaining of severe chest pain. They appear to be in distress and are clutching their chest. What steps would you take to assess and care for this patient?
Imagine working in a bustling emergency department when a patient arrives, visibly distressed and clutching their chest, complaining of severe chest pain. In this critical moment, the primary task is to swiftly assess the patient's condition, determine the cause of their distress, and provide immediate care to alleviate symptoms and stabilize their health. Upon recognizing the urgency of the situation, my immediate actions would be to approach the patient calmly, while simultaneously assessing their airway, breathing, and circulation. I'd gather crucial details about the onset, duration, and severity of the chest pain, alongside associated symptoms like shortness of breath or nausea. Simultaneously, I'd initiate oxygen therapy via nasal cannula at a high flow rate to enhance oxygenation, and promptly set up cardiac monitoring to evaluate heart rhythm and signs of cardiac distress. Meanwhile, I'd establish intravenous access for potential medication administration or fluid resuscitation. As I conduct these assessments and interventions, I maintain open communication with the attending physician, updating them on the patient's condition and collaborating on further diagnostic tests, like ECGs or cardiac enzyme levels. By swiftly implementing this comprehensive approach, we stabilized the patient's condition, alleviated their symptoms, and expedited necessary diagnostic and therapeutic interventions. The patient's chest pain subsided, and signs of hemodynamic stability and improved oxygenation emerged. This scenario underscores the criticality of prompt assessment and intervention in the emergency department. By executing a systematic approach to care delivery, we effectively addressed the patient's immediate needs and initiated timely interventions to optimize their outcomes. It underscores the significance of preparedness, teamwork, and clinical expertise in delivering high-quality emergency care.
Tell me about a time when you spotted a discrepancy or inconsistency in information that might have caused problems if you had missed it.
While working in a busy hospital ward, I was responsible for reviewing and administering medications to patients. One day, as I was conducting medication reconciliation for a newly admitted patient, I noticed a significant inconsistency in their medication history. My task was to ensure accurate medication administration and prevent potential adverse drug interactions or complications for the patient. Upon identifying the discrepancy, I immediately cross-referenced the patient's current medications with their medical records and admission documentation. I discovered that a medication listed in the patient's history was contraindicated due to a known allergy documented in their records. However, This medication had been inadvertently prescribed by the admitting physician and included in the patient's medication orders. Recognizing the potential risk to the patient's safety, I promptly brought the discrepancy to the attention of the healthcare team, including the prescribing physician and the charge nurse. I communicated the situation clearly, highlighting the patient's allergy and the need to rectify the medication order to ensure their safety. Thanks to the timely intervention, the medication order was promptly amended, and the patient's treatment plan was adjusted accordingly to mitigate the risk of an adverse reaction. The patient was spared from potential harm, and their care proceeded without incident. This experience underscored the critical importance of thorough medication reconciliation and vigilant attention to detail in healthcare settings. By spotting and addressing the discrepancy proactively, I was able to prevent a potentially harmful error and uphold the principles of patient safety and quality care. It reinforced the value of teamwork and effective communication in identifying and resolving issues that could compromise patient outcomes.
Tell me about a sensitive or volatile situation that needed careful communication.
In my role as a nurse, I encountered a sensitive and volatile situation involving a patient and their family members who were distressed and upset about the patient's deteriorating health condition. My task was to navigate the emotional turmoil and effectively communicate with the patient and their family members to address their concerns, provide support, and ensure that they were well informed about the patient's condition and treatment options. Understanding the gravity of the situation, I approached the patient's room with empathy and compassion, acknowledging the family's distress while remaining calm and composed. I actively listened to their concerns, allowing them to express their emotions and fears openly. I provided clear and honest information about the patient's current status, prognosis, and the medical team's efforts to provide the best possible care. In addition to verbal communication, I utilized nonverbal cues such as maintaining eye contact, nodding and understanding, and offering a reassuring touch when appropriate to convey empathy and support. I encouraged the family to ask questions and clarify any misconceptions or uncertainties they had about the patient's condition or treatment plan. Through careful communication and emotional support, I was able to establish a sense of trust and rapport with the patient and their family members. They expressed gratitude for the compassionate care and the opportunity to voice their concerns openly. Despite the challenging circumstances, the atmosphere in the room became calmer, and the family members appeared more reassured and informed about the patient's care plan. This experience highlighted the importance of effective communication skills, particularly in sensitive and emotionally charged situations. By approaching the situation with empathy, active listening, and clear communication, I was able to alleviate the family's distress, foster trust, and facilitate a more collaborative relationship between the healthcare team and the patient's loved ones. It reaffirmed the significance of patient-centered care and the positive impact that compassionate communication can have on patient and family outcomes.